Your radiation oncologist has indicated you need radiation to treat your prostate cancer. As part of this treatment, you need to follow a few steps to make sure you are ready for your treatment. This video will teach you how to prepare for your CT planning appointment.
The prostate moves naturally depending how full bladder and rectum are. During radiation treatment, we treat your prostate and/or pelvic lymph nodes, and when the prostate is removed, we treat the empty space where the prostate used to be. This video contains two important messages. The first is to have a full bladder, and the second is to have an empty rectum. When you get ready for your radiation treatment every day, you will need to have a full bladder and an empty rectum. This is important because you will have less side effects from radiation treatment to the organs surrounding the prostate. It is very important that you follow the message in that video.
The prostate is a walnut-sized gland at the base of the bladder. It sits just in front of the rectum. To make sure that the organs around your prostate, like the bladder, bowel, and rectum, get the smallest dose of radiation, your healthcare team will make a treatment plan just for you. Before you start your radiation treatments, you will come in for a planning CT scan. For your planning CT scan, you need to have a full bladder. The image shown here is an empty bladder, which is not full enough for radiation treatment. The small bowel may get too much radiation, and this may cause some side effects, such as diarrhea or pain around the tummy. The image shown here is a full bladder, pushing small bowel out of the radiation field. This is how full your bladder should be for your radiation treatment. For your planning CT scan, you need an empty rectum. The image shown is a full rectum with too much gas and stool. This has pushed the rectum into the treatment area, which is getting radiation. If your rectum is not empty, has too much gas and stool, it may move the prostate from the radiation area. This could cause less radiation to be delivered to the prostate, and at the same time, increase the dose to the rectum. This could mean that you will have more side effects. The image shown is an empty rectum, which keeps your rectum out of the radiation field. This is how your rectum should be for your radiation treatment. The position of the prostate needs to be in the same place every day. To make sure your prostate is in the same place for your radiation treatment, you will need to follow the steps in this video. By following the instructions explained in this video, this will help you get ready for your CT scan and your radiation therapy treatments. To get ready for your CT scan appointment, you need to drink 500 milliliters of water 45 minutes before your appointment time. Please try to empty your bowels the morning of your appointment. If you need to go to the washroom once you get to the cancer center, please let the radiation therapist know. You will need to start drinking your water again to refill your bladder. It is very important that these steps are followed. Otherwise, we may need to reschedule your CT scan appointment. You will follow these same steps every time you have your radiation treatment. Radiation therapists will look at your bladder and rectum on a CT scan on the radiation treatment unit before every treatment. You will not be able to get your treatment unless your bladder is full and your rectum is empty. The CT scan will take about 20 minutes. You will get a small tattoo as part of your treatment. We have to tattoo the area where you will get treatment so that we can make sure you get the treatment in the same place every time. We use a very small amount of ink which is injected under the skin. You will be given 4 small tattoos on your pelvis. We will watch you from behind a window while you get your CT scan. From the CT scan, the radiation therapists will be able to see your bladder to make sure it is full and to make sure that your rectum is empty. If your bladder is not full enough or your rectum is too full, the radiation therapists will ask you to drink more water or to go to the washroom to have a bowel movement. They will repeat the planning CT scan. After the CT scan is complete, you will be given an appointment card with your first radiation treatment time. Your treatment will be in the same position you were in for your CT scan. The radiation therapists will take a CT image every day before your treatment to make sure you are in the right position and that your bladder is full and your rectum is empty. The radiation therapists will not go ahead with your treatment if your bladder and rectum are not the same as they were for your CT scan. Any problems you have keeping a full bladder and an empty rectum, your radiation oncologist will be told. You may be given special instructions, which might mean changing your diet and going on some medications. We hope you will find this instructional video helpful.